Welcome to Focus Today. I'm your host, Perry Atkinson, and delighted to have in the studio with us today Sara Roberson. She is a certified family nurse practitioner with Ventana Wellness, and we're going to be talking about heart disease prevention, which I think should be an interest to just about everybody listening and watching. So, Sara, nice to have you. How you doing?
I'm doing great. Sara Roberson.
Yeah.
I just have to correct that because everybody makes a mistake like that. But thank you. I'm doing great. As you know, February is generally Heart Month.
Yeah.
But right now it's the holidays, and it's a time of giving and sharing and caring and loving.
Yeah.
And that includes loving our heart and how to prevent having the development of heart disease in our future.
Yeah.
And especially for our kids, because there's, as you know, you had Dr. Klein on here a couple of weeks ago, I believe.
Yeah.
And there are epidemics of outstanding proportions regarding the development of diabetes and heart disease, with heart disease being the #1 killer of most developed countries, and especially the U.S.
It's still one of the biggies, isn't it?
It is. It's the #1.
Okay, and #1. All right. So I think we don't think about this until we're affected by it, but we can certainly prevent it, can't we?
Prevention starts really early, and as a mom of young 3 children, it starts with us educating our children about how to eat healthy and helping them to exercise and telling them when to turn off the TV so that they move. And then, but that goes straight into teenagerhood and adulthood and middle ages, and in terms of deciding what we're going to do about our health and how we're going to prevent heart disease.
All right. So it is preventable. That's the #1 thing we want people to know about. And how early should we start looking towards this?
So obviously the earlier the better, you know, the early bird catches the worm, and the same thing with that. We want to prevent heart disease by catching it early on. And one of the screening methods that we actually offer now at Ventana Wellness, where I work, is a ultrasound mediated view of your carotid arteries. And that's a really neat technique that's been developed over the last several years and is becoming more into normal medical flow, but it's a newer technique. And one of the great things about it is it's a completely non-invasive, no radiation way to be able to look and see what's going on in our carotid arteries.
Really?
And the reason we look at that is because we know that most likely what's going on in our carotid arteries is going on in our coronary arteries, which are those big arteries that head toward the heart. So you have to have a very special technician who's been trained really well, because your entire carotid artery is only 8 to 10 millimeters in diameter. And what we're looking at with that is is there any inflammation on the inner lining of the carotid artery, which is the intima media. And so they're looking at the thicknesses of those, and they're also looking to see if they can see plaque. And historically, we've done calcium scoring, and a lot of people have had their calcium scores calculated with different CTs and different things like that. But the nice thing about having the carotid artery screening through ultrasound is that you can actually detect it at a subclinical level. So you can actually detect thickness changes that are indications of inflammation, and then you can also identify soft plaque changes, which are the most dangerous ones because they're the most easily disruptible to flow into smaller vesicles and create strokes and heart attacks.
Wow.
Yeah.
All right. Let's talk about maybe some beginning signs of heart disease. I mean, I know we want to talk about the prevention, but what are some of the beginning signs that people might want to be concerned about?
So that's the hard part, is heart disease is really a silent killer. And a lot of times you don't really see signs until, I wouldn't say it's too late, but until it's pretty significantly progressed. Because when you see a sign of heart disease, it could be, you know, swelling in the legs. That's one thing. You can have peripheral arterial disease and pain, especially with working out. And, you know, not a cramp, but it's like pain and swelling and color changes in your legs. But, you know, sometimes the first thing that people notice is that they're having chest pain and pain going down your arm and up your neck, and there you have a heart attack, and you know that heart disease started well before that time. So what we're looking at is looking at these screenings to tell us, are you somebody who's most likely to develop heart disease, along with other risk factors like the Framingham scoring and items like that.
Is there any blood tests to show this?
So unfortunately, medicine is not a perfect practice. You have to really look at a lot of things combined, and we do have some blood tests that help us to identify if there is likely to be inflammation in or around your heart or in your arteries. And the hard part about humans, or the wonderful part really, is that God created us all so differently, and everybody's different. So you can actually develop heart disease and not have any of those indications in your blood test. But the HSCRP is one that we look at somewhat, but it's not a for sure diagnostic. The homocysteine levels, different cholesterol levels. And that's, of course, an interesting hot debate right now is, what about cholesterol? You know, they're saying maybe we should be taking statins, excuse me, for everything under the sun, it seems like. And
yeah, right.
Yet we know that cholesterol is something that God created in our body to help us with other functions. It helps build our cell walls. It helps us to have healthy bones. It's an integral part of our vitamin D absorption, which is another huge issue that's going on in the medicine media right now. And it really helps with our production of steroid hormones like our testosterone, our estrogen, our cortisol. And all of those things can be really bad in large amounts, but they're perfect in small amounts or appropriate moderate amounts.
All right. As we talked to Dr. Klein, and he was very concerned about, you know, diabetes as a whole, which is an incredible thing. I mean, it's almost epidemic, it seems like, in our country,
yes.
And in particular youth diabetes. Is a diabetic more at risk for heart disease?
Yeah, that's a great question, actually. People with diabetes actually have a more severe form of atherosclerosis and are more prone to developing it. Atherosclerosis being the application from your body of plaque on your arteries. And they definitely have it progressed. And in fact, if you have diabetes, that in and of itself is an equivalent risk factor for mortality in the future, as is the development of heart disease. So if you have diabetes and you have heart disease, then those are just pretty significant risk factors for having a heart event related to a heart disease, such as a stroke or a heart attack, within the next 10 years.
All right, a couple of other quick questions. Is a perpetual, or maybe not perpetual, but a constant high blood pressure an issue?
Yeah. So there are many risk factors that contribute to the development of heart disease, and hypertension is one of them. And in fact, 75% of people over the age of 75 have hypertension, and over 50% of the people at 55 years or above have hypertension. And a lot of it is undiagnosed, and that links right into hypertension being also the silent killer. And it is a significant risk factor, and part of that is because of the way that the pressure affects our arteries, making them sclerotic or stiffer and less flexible. And one of the screenings that we do when we do that ultrasound is you actually have a little blood pressure finger cuff that tests the vascularity resistance, and it looks at how well you can dilate and constrict your vessels, because having nice flexible arteries is huge for just general health, including how your brain is thinking, how your sexual organs are functioning, and definitely how your heart is pumping.
All right, let's get into some of the prevention, and I think this is really important because, as you said earlier, you can't start this any too soon. It has to be lifestyle, doesn't it?
It does, it does. You know, we have a lot of the Americanized thoughts are, well, there's a pill for everything. Why don't we just take a pill? And it would be so easy. Wouldn't it be easy if we could just take a pill? And we have pills, and they're touted as being the pill that you should take, but that's really not the case. You're exactly right. It's lifestyle. And there are many factors to that. One of the worst ones that we as Americans have is stress control. We are go, go, go people. We want to be on the road all the time. We have soccer practice. We have our own yoga classes. We have work. We have deadlines. And then somebody hits their brakes right in front of a yellow light that they should have made. You know, and all of those shoot out our stress hormones. And so stress is a huge issue, and we know that that's one of the main contributors to heart disease, is how you just deal with daily life. And that's one of the things we really like to work at with Ventana, is just how are your risk factors for stress doing, and how are you controlling that? And then of course diet and exercise are huge, huge. And it just goes down to common sense, really.
Well, you know, Sarah, we're coming into the end of the year, first part of the year. Everybody makes these New Year's resolutions. Here we go, I'm going to exercise. And it lasts for a couple of weeks and it fades out. But you have weight resistance and aerobics. Is there a combination, or one more than the other, as far as a lifestyle change to help prevent heart disease?
Right. I think that it depends on your body stature, and it depends on where you're at in your prevention. You know, if you're already a fairly healthy person and you just haven't been exercising, what should you do, and how old are you? there might be different recommendations depending on that, but in general, it's nice to have a really great combination, because having that weight resistance helps with that contractility of your muscles, and it helps to make them stronger so that you're really having a better metabolism, which is helping your heart as well. And then, of course, the aerobic activity, really pumping your heart. Exercise is definitely key because it makes your heart stronger, and it helps that contraction and dilation. It helps the blood flow to just be pushed through. It lowers your stress. It lowers your cholesterol if you need it lowered, and it really lowers it improves your ability to sleep well, which is another key portion.
All right, let me take a quick break, and we're talking about heart disease and the prevention of heart disease. And Sarah's with us today from Ventana Wellness. By the way, you can go to ventanawellness.com or .com and check it out. The incredible resource of all kinds of good, healthy things there. Dr. Klein's part of that, Sarah's part of that, and others. So we'll take a quick break. We'll be right back. Okay, we're back, and our guest today is Sara Roberson. She is a certified family nurse practitioner with Ventana Wellness, and we're talking about heart disease and the prevention of heart disease. And this is something we can all do, and something we all should be concerned about. And it certainly boils down to the basics, and that is exercise and good diet. And with the, I think, epidemic, Sarah, of what's happening with diabetes today is just amazing to me. And so many young kids developing diabetes. Now, type 2 is not only is it preventable, but you can actually recover from it. But man alive, it seems like we're just sugared up and we're not even thinking about this. But diet is a big part of this, isn't it?
It is, and like I said before, it seems to come down to just common sense, but really people don't really realize that.
I can't have those artichoke dips.
Well, that's actually not what I mean, interestingly enough, because that's what people think about it. Yeah. But I would say it's not so much what you can't have, because that puts you in a negative mindset, but what you can have and what you should have, and having a whole mind change to desiring what God wants us to desire and what our body is made to focus on or to function with. And that's, you know, a really high intake of vegetables and fruits, something that we're really lacking. A lot of kids don't like their veggies, and that starts sometimes in the womb, sometimes just as young toddlers. Are we giving them their veggies first before they have, you know, sweets or treats and those kinds of things? But even as adults, we just seem to kind of have a salad and consider that the vegetable of the day or whatnot. So veggies and fruits are huge. The other thing is the intake of appropriate proteins. So we have proteins that are not meat-based, but then we also have lean proteins, so meaning not really the bacon necessarily, but having protein that is from a leaner source of meat. And then interestingly, we also really need fats. We need healthy fats, and we all know this, but we really need to focus our fats coming from olive oil, from olives, from avocado, from nuts. And those are known to be helpful for our eyes, for our brain function, for our heart. And interestingly enough, again, alcohol intake can be either detrimental or helpful. So a small to moderate amount of alcohol intake daily or 3 to 4 times a week is actually seen to lower the risk of atherosclerosis in people in multiple studies that they've been able to duplicate. And they thought it was always just the red wine, and they're finding that, well, maybe it's not just the wine, it's any type of alcohol as long as it's in a low to moderate amount.
What's it do?
They don't know. There's so many things we don't know, which is why medicine is incredible.
I'm surprised we're talking about this, but go ahead.
But my thought is it just burns the cholesterol right out of your arteries when there's too much of it. But a small amount actually helps to reduce the inflammation in the arteries. So they thought the red wine originally was part of it because of the resveratrol in there, but there are multiple factors that we just don't know.
Okay. So protein, a big thing. You know all the fad diets, but there seems to be low cholesterol, high protein, and somewhere in there's got to be a balance.
Right, and that's the key word, is balance with everything, with our exercise, with our dietary intake, with our protein intake, and with our life, just juggling things. It's all about moderation and balance. And if we can hit that nice combination of life being joyful for us and enjoying exercise of some form, because that's key. You have to enjoy what you're doing, or you're not going to do it, especially with New Year's resolutions. You just won't continue that. So enjoying some form of activity, and one of the major risk factors alone is just inactivity for the development of heart disease. And I personally think that one of that is because of the development of television. We just like to sit down and be entertained instead of go out and create entertainment in a safe and healthy way. And we just really need to motivate our kids and ourselves to just go out on walks and bike rides. And right now, playing in the snow and sledding is a great form.
All right, couple of other items. Where does sugar play into heart disease?
So sugar is considered to be an inflammatory product for the body in general. And again, in moderation, it's probably fine. But too much of it really inflames those arterial walls that we're talking about, along with other things. But when you have inflammation in your body, then what happens is the lining of that wall that they're measuring with that ultrasound testing, it becomes not as smooth and slick, so that the cholesterol that's just a little too much starts to integrate into the lining of your wall because of the inflammation from things like sugar. And for some people it's wheat, for some people it's their allergies, and for a lot of people it's their lack of activity or exercise, because that decreases inflammation.
Water,
yes. Does it prevent heart disease? You know, there's not really, I don't think there's been tests like, does water prevent heart disease? But we know that water is huge for our metabolism and for our muscles to do their work properly, and for our basically our body to detoxify. So water is how we detoxify. We flush everything out, and so it's huge. And definitely you want to even consider increasing your water in the winter. I have that on our website. I have a little note on there because it's so dry, especially with our furnaces and lack of moisture, that even our skin starts to feel that.
Everything else, yeah.
Yes, and so water, it needs to even be increased in the winter.
All right, now when it comes to dieting, we've heard all kinds of things, and I'm sure you have too. But eat 3 squares, eat 7 little ones.
Right.
Those of us who don't eat breakfast because we get up at 4 in the morning, we're probably breaking all the rules. How do you recommend eating?
So there are some wrong ways to eat, but there are many right ways to eat, which is nice because we all like to have options. Nobody wants to be told that you have to do it this way. So generally for my patients, I recommend that if they are somebody who is busy and they're not grazers, that they do have 3 meals with maybe a snack in there that are smaller meals, because a lot of us as Americans, our issue is portion sizes. But I think that as long as you're getting in the appropriate foods and you're not skipping more than, say, 6 hours between food, then you're probably doing just fine. And ideally, if you want really great weight maintenance and healthy brain function, you're going to be looking at having breakfast of some kind within an hour of getting up each day, because that really starts to rev up your metabolism.
Okay, I can't do it. So what about a shake?
Right, yes.
Does that work?
No, that counts. That counts.
Okay.
So a shake, a banana, an apple with some peanut butter, a whole grain piece of bread with some peanut butter or some kind of nut butter on there. You're going to get some carb, a little bit of protein, some healthy fat. So just something tiny is what because a lot of people do not eat breakfast.
What about this, we're hearing more and more about these healthy snacks during the day.
Right, yeah.
In between meals, so to speak.
You know, one of the great things about having snacks between meals is we all like snacking, for one thing. And the second thing is potentially it helps you, if you're mindful, to not overeat later on or to have smaller portions, and then it gives us something to burn to keep our metabolism fired up. So basically it's like you start your fire in the morning, and then if it's starting to go down, you don't want it to go all the way down where you have to really stoke it a ton. So if you can have a little snack a few hours later, even just 6, almonds or something like that, then that helps to rev your fire.
Is heart disease more prevalent between men than women, or women and men?
It's about equally prevalent, but the time that it occurs changes. So men generally will develop heart disease earlier. For example, when you're looking at risk factors for an individual, if you have a father or a brother who had the development of heart disease below the age of 55, then that is considered to be premature heart disease development. But for women, it's only if they've had the development in a female below the age of 65. So there's about a 10-year difference in how quickly we develop heart disease is what they're seeing. And part of that might be the different balances of hormones such as estrogen.
Now I realize that some heart disease is severe, but can some of it be reversed?
It can. One of the things I like about that ultrasound screening that we do is it shows the inflammation and then it shows plaques. And plaques come in 3 different forms. They come in soft plaques, which are the most easily disruptible. They come in heterogeneous, which are transitioning into calcified plaques. And then they come in echogenic plaques, and those are the calcified plaques that the body has just kind of scabbed over and is trying to just protect and leave there. And usually you can't really reverse those plaques, but all of the inflammation that you can see is reversible. In fact, even within 4 weeks of having a screen, if you repeat your screen after modifying your lifestyle with improving your exercise and diet, you can actually already see a reduction in the millimeters of inflammation that are lining your carotid arteries.
So, a lot to be said about diet, obviously. And do you have plans that people can get on or help?
We do, yeah. You know, that's one of the biggest factors. People really want to have something that they can hold in their hands and look at and reference. And I think that that is a huge problem a lot of times with people going to their doctors, and their doctor says, you need to lose weight, or their nurse practitioner or physician's assistant, you need to lose weight, and you need to lose 10 pounds by the next time I see you. And that's great. It's true, you know? But so many people are lost with what to do, especially because of all those fad diets you mentioned. They just don't know where to start. They don't know where to begin, even though it seems so simple. So we have a nutritional advisor who oftentimes we'll send patients to, and that's through our body analysis or different programs for weight loss that we have. And she'll sit down and talk to them about what things are going on right now. What do they think they can do? What can you do as an individual? Are you there where you're ready to make complete changes, or do you really just need baby steps? And we really try to meet people where they are because we want them to be successful and healthy.
Well, let me encourage you, check out VentanaWellness.com, and some of these things are available there at the website.
Yes,
yeah,
definitely.
All right, Sarah, is there one exercise that's better than another for heart? I mean, I like
the exercise that's better than anything else is the consistent exercise. So it does matter what it is, but what it is something that gets your heart pumping. So Zumba, super popular right now because it's a fun way to get out there, and you can do it at your own pace, which is a real big thing for people. And you're right, walking, boy, you can do walking anywhere.
Yeah, just requires a good pair of shoes. Lastly, we're hearing a lot of, if I can use the word negative, about statin drugs.
Right.
You want to comment on those? Because that's reduced the cholesterol, and that's the problem, isn't it?
Right. So reduction of cholesterol levels with the use of statin medication can be really helpful in people who are identified as having heart disease, and it definitely can save people's lives. The hard part about it is, well, there's a ton of controversy on how true that is and how not true it is, and who it really helps. And one of the key things that we look at is how many people do you need to treat in order to save so many people. And right now what they're seeing is if you treat 1,000 people with a statin medication, you will save 7 people. If you don't treat the people, you will not save those people, of course, but it's only 7 out of 1,000.
All right, so the numbers,
not significant.
The research is still out on it.
So for the people who really need it, they need it, but people who are kind of borderline, this is the #1 thing that they need to do is change their lifestyle.
Diet, exercise, the obvious.
Stress control.
And there we go. And I think what you ought to do is get on the program earlier the better. Don't wait till the first year. Get a hold of Sarah. She's over there at Ventana Wellness. VentanaWellness.com is the website. And maybe make an appointment and have her do your run through and give you a little bit of a program. Huh?
Definitely,
okay.
definitely.
Thanks for coming in.
Thank you.
Okay, we'll see you next time. We'll be right back.